Hi, welcome back to my YouTube channel. I'm so excited to be back with another video today. In this video, I will be debunking several misconceptions about PCOS and talking about what PCOS is and what it is not. This is because over the weekend, PCOS was trending on Twitter. Yes, it was such a happy moment for the PCOS community because not so often do we get the chance to really explain to people what this syndrome is and what it is not. And even while reading certain tweets, I noticed that people might know what PCOS is, but not fully understand workings of the syndrome in a woman's body, and as such might end up believing certain myths and misconceptions of what PCOS is. So if this interests you, please watch till the end of the video and let's get right into it. If you do not know what PCOS is, it means Polycystic Ovarian Syndrome, and it's a common hormonal condition that affects 1 out of 10 women of childbearing age. Now, I have a detailed video that explains what PCOS is, how to know that you have PCOS, the symptoms, and how to get diagnosed, as well as what to do next. I will link that video in the description box so that you can watch it and understand what PCOS really is and how it affects a woman's body. Here are 5 common myths about PCOS and the facts to clear them up. The first is you must have polycystic ovaries to have PCOS. That's wrong. However, I can understand why people would feel that way. If you go by the literal meaning, polycystic ovarian syndrome, that could be a bit misleading because many women who have PCOS do not have polycystic ovaries, while other women who have polycystic ovaries do not have PCOS. For it to be said that you have PCOS, you need to meet 2 or 3 of these conditions, these symptoms, and that would be irregular menstrual cycle, hirsutism, cystic acne, and so on. And so if you have 2 or 3 of these symptoms, after getting tested, perhaps you might be diagnosed with PCOS. So because of how misleading the name is, for years there's been a request, there's been a debate for the name to be changed from polycystic ovarian syndrome to reproductive metabolic syndrome, and that would just put a focus on the importance of the metabolic and reproductive abnormalities which are the hallmark of this disease, and not just on the literal meaning polycystic ovarian syndrome. The second myth is losing weight will cure your PCOS. I'd like to just oppose this with another myth where people say that women with PCOS can lose weight easily like everyone else. One of the first advice you would get once somebody finds out that you have PCOS is lose weight. Lose weight and everything else would be fine. While losing weight can help elevate certain symptoms like help reduce insulin resistance, weight loss is not a cure-all for PCOS. It will not relieve you of every other symptom that you're going through. Having said that, having PCOS can make losing weight even more difficult by slowing down your metabolism, causing more intense cravings. So now you're craving sugar, you're craving more food, you're eating more than you usually would, making you gain even more weight and other challenging factors. So this would make certain people put so much pressure on themselves because everybody is saying lose weight, once you do you'll be fine. Hence they put a lot of pressure on themselves by trying extreme dieting, intense exercise that would be detrimental to their metabolism and raise their cortisol levels, which makes losing weight even more harder. What you should do as a woman with PCOS, if people keep telling you to lose weight, is block the noise. Go at your own pace. Be kind to yourself and take it one day at a time. You could go by eating very healthy but not trying extreme dieting. You could try less intense workout and All this would be healthier for you and even more sustainable. Losing weight is not the entire cure to PCOS, and losing weight is not even an easy thing to do. The third myth is if your menstrual cycle is irregular, you have PCOS. That's not entirely true. There's so many causes of irregular menstrual cycle, and PCOS is only one of them. A normal cycle is anywhere between 21 and 35 days. Outside of that, breastfeeding, extreme dieting, overexercising, pelvic inflammatory diseases, fibroids, and thyroid disorders could be potential causes for a cycle that's out of whack. So if your cycle is not as regular as you want it to, perhaps you're stressed out, or these other factors I mentioned earlier could be why your menstrual cycle is not regular, and not because of PCOS. So in essence, what are we saying? If your cycle is less than 22 days or is more than 34 days, it is best you visit a gynecologist. They will be able to carry out an exam by running additional tests as well as a thyroid test to find out what the problem could be. Who knows, you might have PCOS, you might not. So do not put the blame of PCOS just because you think that people who have irregular menstrual cycle have PCOS. It could just be anything. It could be anything else. Okay? All right. Myth number 4 is if you're not looking to get pregnant, you don't have to worry about PCOS. Why would you even tell someone that?
Can you imagine? Hey, wow.
Unfortunately, certain doctors and gynecologists are guilty of telling their patients this. They ask you, so are you ready to get pregnant? Are you guys ready to start a family? And when you tell them no, they're like, go and come back when you're ready. When you guys are ready to have kids, we'll come. When you're ready for conception, come, we'll talk about it. Bombastic side eye, criminal offensive side eye to you and yours. If you ever told anybody that, that is wrong. Have people perhaps considered the other symptoms that this woman is going through aside from getting pregnant? There are other symptoms. PCOS doesn't just affect a woman's fertility, it can impact her long-term wellness for the rest of her life. It affects her mentally, emotionally, physically. It has been linked to type 2 diabetes. Half of PCOS women have diabetes or high blood pressure or poor cholesterol levels, sleep apnea, depression and anxiety, as well as other symptoms or other problems they have to deal with. So no, fertility isn't the only thing that women with PCOS have to worry about. So telling them to come back when they're ready to have kids is not only insensitive, but also just very nonchalant and very sad.
You are just a fool.
Here's an honorable mention before we go to the last myth of the day, and that is everyone with PCOS is either obese or overweight. There's this misconception that everyone who has PCOS has to be stereotypically overweight or obese. The thing is, because PCOS is a syndrome, it's going to affect people differently. The way it will affect me is not the way it will affect the woman next door. Having said that, it is more common to be overweight or obese if you have PCOS. However, there are people we call lean PCOS women. They're not common, but they exist. But there's a problem with just diagnosing people with PCOS by just looking at them, because it's a twofold thing. Lean women end up being overlooked, and then women who are obese or who are overweight, who have irregular periods, end up being inaccurately diagnosed with PCOS. So it is not just okay to look at someone and assume that this person has PCOS because she's overweight. Okay, there are women who are slim, who are lean, who have PCOS. All right,
you get it? Okay. If you don't get it, forget about it.
The fifth and final myth for today is you can't get pregnant if you have PCOS. Now, contrary to popular belief, this is not true. While PCOS could be one of the few causes of subfertility in women, take note I said subfertility, not infertility. Now what subfertility means is that you're trying to conceive but it is taking a longer time than what is expected. Eventually it will happen, it's just going to take a longer time. Now for women with PCOS, it's going to be a bit harder, and this is because ovulation is less frequent compared to women who do not have PCOS. However, can women with PCOS get pregnant? Absolutely. They can get pregnant either naturally, or they can actually get pregnant through fertility treatments like follicle stimulating drugs. Now, follicle stimulating hormone is used to treat infertility to women who cannot ovulate naturally. So if a woman cannot ovulate, follicle stimulating hormones would be introduced to her body. And the good thing about some of these fertility treatments for women with PCOS is that they are non-invasive and they are available to those who need help with a little assistance to grow their family.
Special grace of God, everything will change.
With this few points of mine, I hope I've been able to debunk some of these misconceptions and myths that people have when it comes to PCOS. Now, while PCOS doesn't have a cure, it is not a life sentence for feeling bad, okay? It can get better. Although you can never get to a point where you can say, oh, I'm free of PCOS forever. PCOS is a lifetime thing. It's something you will continue to manage until the day you die. However, there are certain things you can do to help manage your symptoms and help you feel better as you live your life. Some of these are exercising. Like I said earlier, do not over exercise. Take it one day at a time. Take it at your own pace. Be kind to yourself. Dieting, eating healthy would help you feel better, help with your symptoms. Something else that could actually help to elevate your symptoms could be supplements, and some women take evening prime rolls, other women take Vitex. Another wonderful supplement is inositol. These supplements could help you to curb your symptoms, could help reduce cravings, could help reduce insulin resistance and all of that. So no, having PCOS does not mean that your life is over. While there is no magic pill to making PCOS go away, there is so much that you can do, and everything is in your control. It's in your hand. It's up to you to take the healing into your hands. Thank you so much for watching my video. I appreciate you. Please do not forget to like this video, subscribe to my YouTube channel, and please comment in the comment section if there were certain misconceptions you used to believe or myths you used to believe about PCOS. Please let me know in the comment section below, okay? Thank you so much for coming to watch my video today. I appreciate you. I'll see you in the next one. Bye.